Welcome to the Epilepsy Foundation's videos on epilepsy and cannabis. Cannabis, also known as cannabidiol, CBD, for treating epilepsy has been a topic of interest for a number of years. The Epilepsy Foundation developed this peer-to-peer education for healthcare providers about CBD and epilepsy to provide important factual information and dispel myths and misperceptions about this topic. Recently, a purified pharmaceutical form of CBD was tested like other prescription medications for two forms of severe epilepsy, Dravet syndrome and Lennox-Gastaut syndrome. Both syndromes start in childhood and are associated with very difficult to control seizures, multiple seizure types, and other developmental problems that can progressively worsen. These videos were designed to share what we know, what we don't know about CBD and epilepsy, and includes published data on the first FDA-approved CBD product for treatment of Dravet and Lennox-Gastaut syndrome. The participants share their knowledge and experiences about what to consider about CBD in general and tips for counseling people with epilepsy and families. The project was funded in part by Greenwich Biosciences. The Epilepsy Foundation editorial board of Epilepsy.com and staff had complete control on the creation and review of this content.
Welcome to the Epilepsy Foundation's video on cannabidiol in epilepsy. My name is Patty Osborne-Schaefer. I'm Associate Editor of Epilepsy.com and Senior Director for the Epilepsy Foundation. And I'm joined today by Dr. Joe Servin and Dr. Barry Goodall.
My name is Joe Servin. I'm Editor-in-Chief of Epilepsy.com and an adult epilepsy neurologist at Mayo Clinic in Scottsdale, Arizona.
Hi, I'm Barry Goodall. I'm a professor of pharmacy at University of Wisconsin-Madison and the co-editor of the medications section of Epilepsy.com.
We're going to talk about the practical kind of advice or guidance to people who have questions or concerns about using cannabidiol for epilepsy. So here we are mimicking our healthcare team. We have our pharmacist, our neurologist, and nurse. So as the nurse, I'm going to get to ask you the questions. Okay? So first, I think we have a family come in, and there's one person with epilepsy, concerned spouse, and parents, and saying, we've heard all about this on the news, I want to do it. What can I do, and can you prescribe this for me?
Let's get back to the basics. What's the diagnosis that I'm dealing with here? Yes. And what are the appropriate therapies that I can choose for that diagnosis? Now, how cannabidiol may work into this is that if within that discussion they have, let's say, Lennox-Gastaut or Dravet syndrome, then I will probably talk about an FDA-approved agent before I kind of talk about things that are not FDA approved.
So kind of confirming the diagnosis and then putting in all those treatment options together, and check the box. What have we tried? What have we not tried? And what's reasonable given, your situation. So I really like that step one, kind of confirm your diagnosis and start the discussion there. So Barry, let me ask you this. Someone doesn't have access to cannabidiol, or can't wait until it's approved, and they want to consider, a different form of cannabis, or medical marijuana. What would you guide them on in terms of as a pharmacist?
Sure. Well, I think that's what makes this an interesting area and somewhat confusing for both patients as well as prescribers. Typically when we're talking about an anti-epileptic drug, we're talking about one specific molecule in one or maybe a couple different dosage forms that's been evaluated. Well, we do have that now with Epidiolex, purified cannabidiol, but we have a host of other products that are out there. And the problem with that is because they haven't gone through a regulatory process, and there really are no standards that exist for the purity, the content uniformity, potential other ingredients that may be in these other forms of CBD that are out there at dispensaries or through the internet. There's been concerns that the FDA has raised in the past when they've gone and looked at some of these products that they don't contain what they say they contain. So unlike some other prescription drugs where we have a pretty good assurance of what you're getting in that vial that's coming from a manufacturer, we don't necessarily have that with these non-FDA approved products. But for medications that are licensed in this country, there are standards. The USP, the United States Pharmacopoeia, has set guidelines and standards for all these things of purity and content and so forth that companies need to abide by.
If the patient comes to you after they have talked to me and they tell you they're taking an edible or they're taking something from a dispensary, what do you say to them?
So good question. So I essentially follow up on what you said, but then I just say, what did you get? And half the time the discussion points out that a person will learn from themselves that they really don't know what they have, right? So my guidance to them is what questions to go back to the dispensary to ask. What is in this? What is not in this? And I actually ask them to bring it in. So it's even learning how to read a label, how to ask the questions at the dispensary, bring that information back to me. And so if you decide to then go that route, be mindful of and still be careful of side effects or some of the other concerns. So this leads to another question. People often say, well, I want to try cannabis because it's a plant, and because it's natural, so that means it's safe. And these other things you're giving to me, aren't.
Yeah.
How do you answer it?
Natural does not equal benign.
What I try to get to the point of, again, making that same distinction that I know natural is often a euphemism for safer, more wholesome, but to show that that isn't the way it works necessarily.
Yeah. So this kind of leads into a discussion with a patient family that's coming in about what could they expect of side effects? Because again, I think people think that there aren't any.
I think that the biggest thing that we can glean from the trials is that sedation is one of those aspects, and I have to often define that term to mean sleepiness, tiredness, maybe not the same amount of energy, and that has to be balanced. Again, how effective is this for you? There are, of course, others that we always worry about in any seizure drug, the gastrointestinal complaints as you start taking this, those type of issues, making sure there's no allergy.
So I think one of the interesting things and useful things we've learned from the Epidiolex clinical development program is about the potential for drug interactions. And what we have learned is that cannabidiol can inhibit some drug metabolizing enzymes. This may explain some of the sedation that was seen in the studies, especially when CBD was combined with clobazam, that the active metabolite of clobazam was increased and caused sedation.
And what I think is interesting with this product is that maybe we need to help people think about what drug interactions are in terms of how the body works. So we're fine, because you've just described that so carefully here, that you found that in the controlled trials, but the body has to metabolize and break down any other kinds of cannabis product that you act.
We're going to help people use these formulations and these products safely. They have to be willing to talk to us about it, because if we don't know, we can't guide and we can't counsel.
So number one, talk about it, right? And we got to, of what you're already taking, not only what you do want to take, go back and know your diagnosis and might be proper for, or possible, or feasible even, given what your diagnosis is. So how do you do that risk-benefit discussion, and do you put in that risk of the seizures in causing side effects or risk of seizures and dangers?
What I do is that I actually use those terms. Here's the positives, here are the negatives. Now you have to kind of decide with me, which way do you want to go?
So you're taking a very important step here is by you going back to what's that person's goals. You know, how are
Correct.
they affected? What
Correct.
do they want to see change? So then you can really guide to that. So that can help you lead to setting appropriate expectations for them.
Right.
And I think that's a great point. I think what's different about the whole CBD and cannabinoid story versus virtually any other drug that I can think of is that this has really been brought up. It's been a grassroots from the patient, the public, up to the medical community, and creating a demand for the drug.
I think that the biggest thing that I would say as a take home is that we now have another option, and it's an interesting option because it seems to work differently than others. And two things I would say on that is that number one, if this is something that you're interested in, ask. Don't be shy. Just put it out there so that at least it's considered, depending on how things evolve in terms of its usefulness for different conditions. And the second thing is that if you are taking a artisanal or dispensary version of this, lay it out as well.
Thank you very much for joining us here today. This is Patty Osborne Schaefer. Thank you to Dr. Goodall and Dr. Servan. This is the Epilepsy Foundation on cannabidiol and epilepsy.